The House Appropriations Subcommittee on Health and Human Services is called to order. I would ask those who are still conducting conversations if you could take it outside. Thank you. Will the clerk please call the roll?
Chair Morse. Here. Representative Martis. Here. Representative Hood. Present. Representative Brayback.
Here.
Representative O'Neill.
Present.
Representative Puri.
Here.
Representative Farhat.
Here.
Representative Price.
Here.
Representative Skaggs.
Here.
Representative Snyder.
Here.
Representative Green.
Present.
Representative Bolin. Here. Representative Mearman.
Here.
Representative Kuhn.
Here.
Representative Steele. Here. Madam Chair, all members are present.
Thank you, Clerk. Representative Martis moves to approve the February 1st, 2023 minutes. Hearing no objection, the minutes are approved. Also, Rep. Green moves to excuse absent members, and hearing no objection, the minutes are approved. Or, I'm sorry, that motion is approved. Okay, so thanks for being here today, everybody. We are planning to hear testimony regarding the executive's recommendation for the Children's Services Agency portion of our budget. So we will have members of the Children's Services Agency as well as some presenters from child welfare services agencies. But first I wanted to briefly talk about what happened at Michigan State last week and acknowledge that we are very sorry about the loss of life and those that are still fighting for their lives. We also, as the Health and Services Committee, will be looking into ways that we can address gun violence from a public health perspective, because it actually is a crisis for our public health. More to come on that, but I just wanted to acknowledge that we had such a tragedy in this community, but sadly that tragedy happens every day in cities and communities across our state. So first, we would like to welcome members of the Children's Services Agency to present their testimony.
Good morning, Chair and members of the committee. On behalf of the Department of Health and Human Services, we appreciate the opportunity to be able to speak with you today on our children's services work. Joining me today, we have Senior Deputy Director of the Children's Services Administration, Demetrius Starling, as well as Senior Deputy for our Bureau of Financial Affairs, Amy Epke. My name is Lou Robel. I'm the Chief Deputy of Opportunity. We know that we certainly want to make sure there's plenty of time for our private providers to be able to speak after us. So we have some slides here that I'm going to present, and we will plan on spending about 10 minutes walking through these, and then are happy to answer any questions, anything that we didn't cover that might be of interest to the committee. So hoping here that the technology works, I'm going to look for confirmation if the sharing is able to be seen by members of the committee.
You're good to go.
Wonderful. And so Director Starling, I will turn it over to you, sir.
Thank you, Lou, and good morning, everyone. Madam Chair, thank you for the opportunity for the department to be able to do a quick overview over the 2024 CSA budget. So this first slide represents our priorities within Children's Services. And this is a placeholder that I routinely cover, not only for our internal staff, but also our external stakeholders, to keep us grounded in our overall mission and vision. So when we talk about safety and well-being of our children who are in our care, I think it's incumbent on us to ensure that if and when kids are brought into our systems, that we keep those kids safe. Keeping children safe within their families, this is a huge underpinning of the work that we're doing right now in regards to prevention services. So making sure that we have a keen focus on how we keep kids safe, within their systems is extremely important and incumbent of all of us as leaders internally and externally to really lean into. Next, I have ensuring equitable practices in child welfare systems. Just want to make sure that this is something that we, not only from a practice standpoint, but a policy perspective, that we keep as a keen or major focus, but also timely reunification and permanency of our families. Next, we have just some data to an overview of our CSA statistics. And again, without going too far in depth here with the time limited that we have, we are a state administered system, of course, that encompasses 83 counties, 5 business service regions, approximately 3,614 staff, contracts with 58 agencies to provide family preservation, foster care, licensing, and adoption services. And below here, you will see basically the 5 major components of our child welfare system: CPS, foster care, prevention, adoption, and juvenile justice program. Next, I just want to take a second to talk about some of the entryways, the pathways that our youth come into our system. So within our child welfare systems, there can be a CPS complaint, of course, that's generated through our centralized intake system. And within that, you have cases that are not accepted for investigation. And those cases in the future will, of course, be diverted to our prevention pathways, either through 211 or other methods to make sure that those families get the assistance and support that's needed, or they can be accepted for investigation. So within those investigations, there are 5 disposition categories that those cases can fall under. Category 1, which is court intervention, where in those instances, a petition has to be filed with the courts asking for removal of that child or children. Category 2 is a high case where there are services provided to that family, whether the kids remain in the home with services or placed in out of home with the non-responding parent for services. Category 3 is an open close situation where we monitor the family, provide support and guidance, and when the risk to that particular family or youth is not as high as initially deemed or disposition, then we can close that particular case out. Category 4 is one where there's not enough evidence to support the allegations within that complaint, but there is enough that we feel as a department we should provide in-home services. So families together, building solutions, families first, family reunification programs, and our FFPSA, which is our Families First Prevention Service, are different ways that we could provide services and support to those families in the home. Category 5 is a case that has no evidence to support that there's any abuse or neglect that's occurring in that home. Juvenile justice, we have a different diversion or system of pathway for those kids. So we have youth that come through our PA Act 150 programs to provide that acceptance, care, and discharge of youth committed as public wards. And these, without going into full detail, are different paths, either through our department or court ordered youth that go through a juvenile justice program that either can lead to those kids being discharged to their community settings, or step down program, or to another juvenile facility within our department. Also, in that third line there, we have out of home pathways that we have for our youth. So either a congregate care institution or foster home, kinship care provision, which we're heavily leaning to as a department, are different ways that we see our kids come through our system in out of home settings. And as far as exiting our systems, we have adoption, reunification, which is of course the goal of our departments is to have those kids reunify with their families, independent living for those older youth that we deem is necessary, or they're at the point that they can be considered for those programs, or guardianship. Next slide.
One of the areas of in-flight work that we wanted to ensure that we touched on this morning was around our child welfare technology system development. And so we have been underway here with work around conversion from our existing what's called SACWIS to our new comprehensive child welfare information system. This is a great opportunity for the department and our private providers to really lean in and develop a system that's really tailored to meet the needs of Michigan and of our child welfare system. Now, this comes upon the back of a mandate from the federal government that requires all states to do this. There is some evolution within the technology world that the feds want everybody to participate in related to ensuring kind of data quality. That there's a shared kind of technology through modular designs, if you will, to really kind of help ensure that our 7,000 users out there in the both public and private child welfare space have tools that are designed to meet their needs, allow them to do the great work that we need them to do with the families that they engage with in a manner that provides efficiency for themselves in a manner that is allowing them to ensure child safety. So we're going to talk about this a little bit later in the presentation when we get into investments. However, wanted to note that this in-flight work is incredibly important to us.
Next, I want to talk about our juvenile justice reform. So juvenile justice reform is being implemented based off the recommendations of the Michigan Task Force. And I will be remiss if I didn't mention or give a big thank you to Lieutenant Governor Gilchrist for your leadership on this front. Without your staunch leadership and guidance and vision in this particular area, I don't think we would be where we're at right now. So this reform, we believe, will increase community-based supports for our youth in the juvenile justice systems and create a shared technology and data reporting system to increase transparency, accountability, and collaboration across all systems. So looking at the objectives, of course, the things that really want to highlight is safely reducing our placement in detention and residential placements and increased community placements, increasing the safety and well-being of youth impacted by the juvenile justice systems, and also better aligning our practices and research with constitutional mandates. Next slide. Next, I want to take a second to talk about our placement array development. So Michigan and nationwide, we're seeing a shortage of placements due to the pandemic. The need for this specialized treatment for youth, unfortunately, is at an all-time high. So right now, we want to highlight the efforts to address community and institutional care to address the youth's need, and also cross-system collaborations with our children's behavioral health systems. So again, I think this document pretty much outlines where we want us to go or our vision within the department. Therapeutic short-term assistance and guidance for our youth, transitional placement expansion for our youth, community reintegration programs and homes, enhanced treatment foster care system, enhanced relative and kinship care efforts, and child caring institution reinvestments, where I believe that our private partners will speak about a little bit more later in the presentations. Next slide. Also, nationwide, we, of course, we're seeing some really challenging things in regards to our workforce. So within our child welfare and juvenile justice systems across both public and private sectors, we are seeing an unfortunate shortage of employees. This is challenging and burdening to the field, which is usually driven by passion for this work. It is emotionally demanding and it has unpredictable hours, unfortunately. Due to the pandemic and CPS reform, there is a higher level of acuity of cases that we're starting to serve. So right now, when you look at this slide, it really outlines some of the challenges. We have 431 vacancies across our child welfare systems. Our starting pay at this time is around $23.47. And again, as I stated, it's emotionally demanding. The burnout is evident, and there are unpredictable hours within child welfare systems. So with that stated, I believe that I'm transitioning over to Director Epke.
Good morning. I'm Amy Epke, Senior Deputy Director of Financial Operations here at the Michigan Department of Health and Human Services. And this morning, I'm going to take a few minutes to talk through the investments that you'll see in the executive budget for fiscal year 2024, specifically in the Children's Services Administration. Before I do that, though, I do want to mention that there are 5 overarching priorities included in the budget that you'll see. In addition to supporting children and families, you'll also see an investment around public health preparedness and response, strengthening the healthcare workforce, expanding behavioral health and physical health access, and investing in community-based public safety. So when you look at the executive budget comprehensively, you'll see a lot of the things that we've heard from people throughout the state in terms of priority areas. And we're excited about the opportunity to work with both this community and this committee and our partners, many of who are joining us today on this budget as it progresses forward. So with that, I'm going to take a minute to talk specifically about the 3 investment areas in the Children's Services Administration. The first being increasing foster family support. Michigan relies on volunteers to provide placement for children who can no longer remain safely at home with their family. Based on surveys from foster parents, we know that several foster parents end their license for a couple of primary reasons. One reason is the financial support or lack thereof financial support. And then secondly, there's another reason around the need for respite care, or simply put, the need for a break. In Michigan, the standard rate for foster parents is $20 per day. The national average is $22 per day. I think that's worth repeating. The standard rate foster parents receive is $20 per day. I think we all know, how far or how not far $20 a day can get us. So just want to stress that point. The fiscal year 2024 executive budget proposal provides $19.3 million to support an average 8% increase for foster parents, guardians, and adoptive parents. In addition, the proposal also invests $15.1 million to provide relief to foster parents through the establishment of a respite care network. This will allow opportunities for primary foster care parents to take an occasional step away, and short-term providers will step in and receive that respite care financial support. The second priority area I want to talk about is investing in juvenile justice. As you've heard from Demetrius, we are certainly committed to juvenile justice and making improvements as we move forward, and have already taken a number of steps previously. The Child Care Fund is the primary statewide juvenile justice funding structure. The fund, however, does not provide financial incentive for youth to remain in the community, as community-based and residential placements are reimbursed at the same rate of 50%. The fiscal year 2024 executive budget includes $31.5 million to increase the state support to 75% for community-based services. While the Child Care Fund is focused on support for community-based services, there's a staffing shortage in our existing residential centers. The department operates 2 secure juvenile justice facilities, including the Bay Pines Center in Escanaba and the Shawano Center in Grayling. The 2 facilities have the capacity to house over 70 youth with complex trauma and emotional or behavioral needs. While there are additional youth in need of placement, we are currently not at capacity, and this is primarily because of the staffing shortfall and also the high staff to youth ratios that we currently have. So the fiscal year 2024 budget proposes $1.3 million, which would allow us to add 12 additional employees to Bay Pines and Shawano. And then finally, our third investment around Children's Services Administration is related to modernizing the Child Welfare Information System. As you heard from Lou, in 2016, the U.S. Department of Health and Human Services published new rules in the Federal Registry requiring modifications to the case management process. The department has been in the process of implementing the new Comprehensive Child Welfare Information System, also referred to as CWIS. As Lou mentioned, this is a multi-year project. It will be accessed by over 7,000 users for child protective services, foster care, and adoptive case management. Work began in March of 2021, and again, we anticipate this will take multi-years to complete. The proposal before you includes $12.6 million to support continued planning, development, and implementation of the new CWIS system. And I think it's important to note, as I mentioned, this is a multi-year system, so we do anticipate there will be the need for future investments in future years beyond fiscal year 24. And as we wrap up, I again want to thank you for the opportunity to be here today. We're really looking forward to working with this committee throughout the budget process, and we're certainly available at this time or at a later time for any questions that you may have.
Thank you so much to our Children's Services Agency from HHS. If it's okay, we're going to hold questions because we have people here in person and we want to make sure we have enough time for them to present. So if you could just sit tight, we'd appreciate that. Thank you so much. So at this time, I'd like to call up the group that's from Spectrum, Wedgwood, Samaritas, and Orchard Children's Services. So we invited some individuals who are doing the working end of this. We wanted to make sure we heard from them about what needs they're seeing on the ground level that really need to be filled. And so I am going to let you all just take turns and move through your testimony, and we'll do some questions at the end. Thank you.
Hello, my name is Michael Williams, and I serve as the President and CEO of Orchard Children's Services. And again, I want to emphasize that we're in alignment with a lot of the goals that were presented to you today, but what we want to make sure that you see today is the lack of resources in order for us to accomplish our goals. As the starting price of the worker in the state, there's quite a bit of discrepancy in what we are reimbursed. So on behalf of the Association of Accredited Child and Family Agencies and Samaritas, we appreciate the opportunity to partner with the new legislator in addressing the critical, and I mean critical issues facing children and families in our state. We are ready to partner with you to provide our decades of frontline experience and expertise in providing treatment and support to children and families in this great state of Michigan. We encourage the legislature and public officials to sit upon our members, to depend upon our members for expertise and resources, and we will make them available with short notice as we're here today in this challenging weather. Our hope is that this presentation can become a springboard to a better future for the child welfare system, one which includes and embraces the role of accredited, nationally accredited, and nonprofit welfare organizations in servicing our children and families in this great state of Michigan. Thank you. Push the button.
All right. Thank you so much for having us here today. It's wonderful to be here. I do want to quickly acknowledge Representative Braybeck, virtually Representative Green, Representative Hood, and Representative O'Neill. We have loved to partner with you in the past. We're so thankful that you have been able to understand some of what's happening for our services. And welcome, Chairman Morse. We're very excited that you're here. We hear that you might be leading a child welfare task force in the near future, so we would love to work with you. I'm Rachel Sykes. I'm a child welfare executive at Legacy Adoption Services and with Samaritas, both of which work with adoption, foster care services, preservation services. And I'm really honored and humbled to speak alongside these esteemed colleagues. There are decades of deep experience and expertise in child welfare at this table. Last year, my adoption agency, we celebrated our 10,000th adoption for our 45th anniversary. That's a reminder that our daily actions are building legacy for the future of the children in the state. And we're here with you for the well-being of the children and families of Michigan because this matters. And there are over 58 agencies in Michigan. We are answering the call to partner with CSA and to partner with you. So I want to recognize that you are making really challenging decisions in this committee and with the funding, and we really appreciate you. You received an infographic from me that looks like this because there are so many things we could talk about, but we just wanted to give you a little brief snapshot. So we're not going to go over all of that, but the continuum of care in child welfare is complicated and powerful. What we want to do is keep kids safe. We are all about their safety and their well-being for children ages 0 to 23, and this is challenging work. It's hands-on, in homes, 24/7. It's on call. We're dealing with crisis intervention, risk factors that are related to mental health crisis. They're related to domestic violence, substance use. We're assessing needs. We're educating parents. We're connecting and referring to community services. We transport our clients. We're helping with the kids that are the runaways. We deal with human trafficking, and we strengthen bonds with siblings and families and kinship. We do trauma assessments, we do safety plans, we do specialized interventions. My list goes on and on and on. We work with the courts, lawyers, medical providers, therapists, law enforcement, community agencies, parents, relatives, foster parents, licensing officials, fidelity consultants, universities, research firms, and the department. And we have very specific guidelines, policies, and contact requirements to satisfy the state and federal mandates and laws. Our direct line staff are bachelor's and master's level professionals with school loans. We pay them $18.50 to $20 an hour starting, not $23.47 that the department is able to provide, $18 to $20 an hour. And of those things that I quickly listed about these services, one of the hardest things that our staff grapple with is the knowledge that they could work at Starbucks for equal pay, and the worst mistake they would ever make is to mess up someone's latte. Right. So together, we are undergoing necessary system transformation, and this system is undergoing needed change and reform. We are here for that. So what we feel is our best position is stabilization and innovation in this time. What does that look like? We want fully supported programs that can ensure this service delivery to the children and families as our absolute best. And we want to be a strong launching zone for the innovations that we're partnering with the department to complete. So how does that look to stabilize our programs? Family preservation, for example, we stabilize that. What do we get? We get intact families. We stop the flow of children into foster care. We avert the trauma that that creates. And an innovation side, the state saves money when we do that well. We can then engage things like the Title IV-E funding for the FFPSA. We can start those preservation pathways, and we can get this preservation plan of the state on its feet and moving forward in a powerful way. For foster care, how does that work for stabilization? This is a primary service. We elevate safety, we strengthen our focus and our outcomes, and we get out of the lawsuit that we're currently in and end the ISEP. That saves us money. That changes our time and our resource, and it moves it to our best practices and our efficiencies. How do we stabilize preservation services? Our adoption services, we focus on the children that need to have permanent homes and more children getting those permanent homes. And we stop the 245 children that are waiting with zero interest that do not have a family interested in adopting them at this time. If we do that, we help stop the number of children that are aging out of this system. On the top of your infographic, you notice 2 terrible statistics. Those are just 2. There are additional statistics about these children. If we're unable to provide all the resources we can, those children also end up, half of them unemployed by the age of 24. Less than 3% are getting a college degree. And the cycle repeats for them as young parents then start over in this system. We need your help to do this. Again, we know we're here to provide every resource we can, and we would like to partner for you for the resources that we need. We have national research and personal experience and shared expertise to tackle the child welfare crisis in our workforce. We know the issues that are at hand. We know that equitable pay and workload issues and training needs are what we need to focus on. And we know if we get administrative rate increases that we can make a really good difference and we can make change happen so that we have the stabilization and the innovation that we need. We have to stop, though, and thank the Michigan 2021 and 2022 Adoption and Foster Care Task Force. Many of you served on that task force. You came up with multiple recommendations. You passed multiple House bills last year, but you know there's more to be done. There are additional things within that report that are not yet addressed, and we believe that we can continue to move forward into those and create the stabilization that we need. Those admin rates are critical to us in many ways. We need actuarially sound rate reimbursements. We need to be able to pay our staff to keep them in their positions and passionate about what they do and not looking at Starbucks when they're having coffee while they're trying to write their report. We need cost of living adjustments added to our contracts. We need to be able to have the added case management supports like mentors and administrative staff who can handle the small paperwork needs. We need investments in our technology and our IT to help with our hybrid models so that staff have their laptops and their printers and they're ready to go as they're serving children in our community. We need advanced training opportunities so that they can learn how to take our best foot forward with innovation. And we need to be able to address the things that we do as private agencies above and beyond these contracts in order to make this system work. So we hope that we can continue to partner with you and make the stabilization here help innovation become a reality for us. So we hope to be able to meet with you in the future, and my partners and colleagues here would like to tell you more.
Thank you, Rachel. My name is Dan Gowdy. I'm the President and CEO of Wedgwood Christian Services, where our headquarters are in Grand Rapids, but we serve youth and families all over the state. I want to start out by just saying I'm going to provide a little bit of a window into our workforce and what is going on there, because our mission does not have any effectiveness, and directly related to our quality and our quantity of our workforce. It may be 70% of our costs, but it's 100% of our mission. And so with that, I want to pause and say thank you. Thank you to the department and you as a legislator for investing in child welfare last year. We would have been in a much different place, a dark place now, if it wasn't for that investment. I don't know where we would be honest with you. But so thank you for that. Wedgwood has been around for 63 years. Our core business is in that residential treatment program. So we provide clinicians, we provide behavior analysts, we provide OT services, 24/7 nursing to deal with these special needs that the kids are coming to us at. They got serious trauma. It was bad before the pandemic. It has broken since, and that's what we're looking at. And if we did not have that investment, we wouldn't be able to respond or even think about responding to the unique needs going forward. So thank you for that. The workforce is where the magic happens. But the pandemic has had a devastating effect on our ability to accomplish that mission. So before the pandemic, turnover was creeping up. In 2020, our residential alone turnover was 70%. 70%. And that's been over 50% in the 2 years following. In fact, there was a 12-month period between June of 2021 and May of 2022 where we had 87% turnover on our frontline staff. 87% turnover. And if the work is about those quality and quantity of those touches, how do you do that with that turnover? Well, you don't. For 63 years, Wedgwood has been serving this, and we are ready to serve this mental health tsunami that's in front of us. But if it wasn't for our frontline managers and supervisors, I don't know if we would have had a Wedgwood right now. And we are not the only story. There's a number of CCIs that aren't at this table that were in business 2 or 3 years ago. So, and so last year, at the direction and encouragement of Director Starling and CSA, Wedgwood made a $1.3 million investment in our workforce. We raised pay to $22 an hour. I believe the $23 that was put up there was more of a state rate. The nonprofit rate is much less. Moving to 22 was a huge investment from 15 to 22. And your comment about Starbucks is so true. There's so much on the line with these staff. So $22 an hour last June, we received, with an advertising campaign, 2,900 applications. 2,900 applications we received. We hired 100. That's a 3.4% higher rate. When I talk to other agencies, they're experiencing very similar. About 40% of those applications are ghost us. They don't respond to emails or texts. I don't know what's going on there, but it's serious. The other attrition has to do with fit and boundaries and capabilities to do this very difficult job, because kids are coming to us trafficked, unique substance abuse. They're coming to abuse and neglect, and dealing with that trauma takes a special workforce. So with that in mind, we need continued investment in that. And so what I mean by that is, yes, we need to continue to look at pay, but not where it is, but where it's going. Was it Wayne Gretzky said, I had the puck, and I'm not the smartest, fastest guy on the ice, but because I skate to where the puck is going. We need to skate to where the puck is going. And so that means training programs, investment programs. That means good pay that keeps up. Bank of America says that frontline customer-facing jobs will outpace every category as far as wage increases. We have to stay ahead of that. So, and regarding the investment, we have onboarding programs, competency-based programs, but even that, We believe it takes 6 months to train a staff to competency, but it takes 2 years for a staff to be proficient in this work. We start now, we can get somewhere, but every time, every day, every week, we delay that investment, not just in acquiring staff, but also investing in their proficiency and their ability. So my message to you is thank you for that investment, and thank you for continued investment to help us develop the individuals that make this magic happen. Those are the frontline staff and the frontline supervisors that translate mission, vision, values into action every moment of every day. Thank you.
Good morning. Thank you, Dan, for that very passionate synopsis on the workforce involved with our not-for-profit agencies. My name is Stacy Bowens. I'm an executive director with Spectrum Human Services. So I want to thank Madam Chair and the committee members again for the time that you're taking today to hear from us about the very critical needs that are facing children and families involved in the child welfare system here in Michigan. Spectrum Human Services and its affiliate companies have been around for 47 years. We've been on the front line, as many of my colleagues here, in providing services to the most vulnerable and needy children here in Michigan. In particular, our Spectrum Juvenile Justice Services is actually the last private providers of secure juvenile justice services. And so we are seeing the challenges, as Director Starling and others from the department have mentioned, facing those that are involved in the juvenile justice system. I want to just take a little bit of time today to talk a little bit about the programming in our child caring institutions. You hear that label referenced often as CCIs. We really need to think of these, and they are residential treatment facilities. The youth that are being served by residential treatment facilities are secure juvenile justice involved youth that come in, as Director Starling mentioned, either through the state system as a state ward or through a county-based system or through the courts as a court ward. Our residential treatment facilities also service youth that unfortunately cannot remain safely in their homes due to the abuse and neglect that they have experienced and the extreme mental health challenges and behavioral challenges that many of our youth are facing today, that many of you see in the news and many of the stories you don't see that come across our path as not-for-profit organizations. We can certainly talk about the financial needs that we need to have available to us to provide those services, but I don't want the committee to forget that this really is about mission work for all of the agencies here and those that may come behind us speaking. We are committed to serving our children and families that have been impacted by abuse, neglect, and those involved in the juvenile justice system. And so for those youth that need the most critical needs in our residential treatment facilities, we do again have a secure juvenile justice facility. Again, Spectrum Juvenile Justice is one of the last facilities, private facilities in Michigan. We're able to service in 2 of our centers 100 youth each. While that seems like a large number, right, because of staffing issues and challenges, those numbers have decreased in terms of our ability to service those most critical and vulnerable children. But I also want to take a moment with the department to acknowledge also the work that is being done to reform juvenile justice services here in Michigan and the focus on community-based placements, as well as making sure we do have residential placements that the most vulnerable children and youth need. And so in our secure juvenile justice facilities, we do provide evidence-based treatment services. They learn about restorative justice. We prepare them with independent living skills, job skills, to be able to come back and safely integrate in the community. Spectrum Child and Family Services, on that end of our affiliate companies, we also provide community-based juvenile justice services. So for those youth that don't need those residential services, as Director Starling and the department and others mentioned, we have community-based placements that need to expand, but we cannot expand those critical needs services without the support of the appropriate appropriations. So we stand with the department and advocating for those needs to service those children in the community, and when they can't be serviced safely in the community, such as a foster home or relative placement or what we call an independent living placement or supervised independent living placements, when those youth can't be kept in the community safely, we want to stand up and lift up our residential treatment providers who stand at the ready, as Wedgwood does, and my partner in this work in providing residential services for abuse and neglect youth, and what we do at our Spectrum Human Services and companies, the secure juvenile justice work. These youth really need our help, right? And we shouldn't get lost in all the bureaucracy of things to forget at the end of the day, these youth, when they graduate out our system, and do they really graduate? Many of us were young people with challenges, and we had support of family, right? We had support of friends, we had support of communities. Some of these youth don't have that. We stand ready as not-for-profit organizations to help be their support and to help them develop those resources and support those families so that they can successfully integrate back in the community and not wind up as a statistic in prison. That is not what we want to see for our children here in Michigan. So again, we stand ready to support the legislature in those efforts. As my colleague mentioned, we stand ready to partner on any child welfare work groups to provide the thoughtfulness and the innovation that we would like to bring to transforming our system. Michigan has always been a leader in child welfare services, and my colleagues and I stand ready to do that in partnership with the Michigan Department of Health and Human Services, as they really have demonstrated through the support of the stabilization dollars that were mentioned earlier, the support of transforming our system. So we believe in that mission and cause with the department, and we welcome the opportunity to partner with committee members, meet with you individually, and be a part of this transformation that will take place here in Michigan. Thank you for your time today.
Thank you so much. And if you could just sit tight, we have one more speaker, and then we'll open up the floor for questions. So I invite Ms. Janet Reynolds Snyder from Michigan's Federation for Families and Children, who is joining us online.
Yes, good morning, and thank you very much, Chair Morse and members of the House Appropriations Subcommittee on Health and Human Services. We really appreciate this opportunity to be with you today to discuss fiscal year 24 budget recommendations that hold key impact on children and families throughout Michigan. I'm Janet Reynolds Snyder, Executive Director for the Michigan Federation for Children and Families. I also serve as immediate past president of the National Organization of State Associations for Children. My view of child welfare is uniquely shaped by both our own state's health and human services systems, as well as the national perspective in partnering with other states to build a high quality continuum of care. I'm also pleased to introduce today one of my colleagues from the Federation, Elizabeth Henderson, who is the Federation's Director of Policy and Research. As a bit of a backdrop, the Federation is a statewide nonprofit association whose nearly 60 member agencies, all private, nonprofit, community-based organizations, work through contract with the Michigan Department of Health and Human Services to provide supportive services to children and families throughout all 83 counties in Michigan. The mission of the Federation is to influence public policy and practice in support of the highest quality of services for children and families. As you've heard here today from our colleagues here today, nonprofit organizations, Federation members are mission-driven, playing a vital role in providing services and positive outcomes for the overall health and well-being of children and their families throughout the state. Nearly 100% of family preservation, adoption, residential treatment services, and nearly 50% of all foster care services are provided by nonprofit agencies in Michigan. Federation members have also established a statewide network of home visiting, counseling, and behavioral health services throughout the state. The Federation has been around for over 50 years, providing a collective and expert voice on behalf of its members and working alongside State Department leaders as our colleagues are today here, Director Starling and Lou Rubel, Amy Epke, and our legislative leaders, you all, with shared responsibility to continuously help families in Michigan communities lead lives of greater health and opportunity. As a member-driven organization, the Federation advances budget priorities based on the voice expertise of our members. In connecting with our members early this year and late last year, our fiscal year budget priorities for the program areas of, budget priorities for reimbursement adjustments in the program areas of family preservation, foster care, independent living, adoption, residential treatment, and juvenile justice and behavioral health will be finalized and shared with each of you within the next week. I do want to emphasize, and I'm really pleased to support the governor's budget recommendation of providing new funds to Michigan's healthcare workforce and improve the state's ability to recruit new talent to the healthcare professions. And I think many of my colleagues here this morning have talked about different challenges within the workforce. Current labor shortage is well documented across multiple industries, both strained in behavioral health and child welfare systems, with the unprecedented challenge of attracting qualified candidates and retaining experienced workforce needed to serve and support the well-being of children and families. Now more than ever, it's just really crucial that the state and federal government are nimble and responsive to the needs of their contracted partners and community-based organization during these uncertain times. So we do support the $210.1 million for direct care wages included in the executive budget recommendations to increase wages to direct care professionals providing Medicaid behavioral health services, and the $5 million for behavioral health recruitment supports to attract and support people interested in training to become behavioral health providers. We also urge that the state include child welfare professionals who need the same recognition and opportunities to advance their careers in working with children and families. Equitable compensation is critical to staff retention, which ties directly to outcomes for youth and timeliness to permanency in many cases. We ask your support of $10 million in an appropriation necessary to provide scholarships and loan repayment programs to attract and support people interested in child welfare, specialty work to meet those workforce needs. The Federation also supports the governor's executive budget recommendation of $19.3 million, supporting an 8% rate increase for foster and adoptive and juvenile guardians. And I know Director Epke described the situation very beautifully and the importance of it here. The Federation is strongly in support of this recommendation of the governor's as well. So thank you so much for your time today. We look forward to working with you further in partnership, in meeting with you in person on a more regular basis. We truly are pleased for this chance with esteemed members of this committee, working with you and other of your legislative colleagues, along with leadership at Michigan Department of Health and Human Services and other partners in building important outcomes for the health and well-being of our Michigan children, youth, and families. So thank you very much, Chair Morse.
Well, thank you so much to all of you for your testimony today. This body, it takes this work extremely seriously. We do recognize that we are taking care of our most vulnerable in the state. And so we will be working really hard to make sure we can do as much as possible with what we have. So with that, I'm going to pose the first question, actually, which may be for HHS, but maybe someone else can weigh in on this. With regard to the respite care support program, is that something that already exists, or we're creating that? And if we are creating that, are we looking to other states for how they do that? I'm just wondering, how quickly we can move forward with that, I guess.
Lou and Amy, I can definitely start, and you guys want to chime in. So respite as a whole is not something that's been fully codified as a program with our department. I know that in regions, we've had different models that have been utilized over the years, but this is something as a whole we feel like our child welfare system needs, not only from the feedback that we receive from our foster parents, but also, when we look at the fact that at a record rate, we're seeing instability in a lot of our placements, and also a need for our child welfare systems to really lean into overall foster care and adoptive parent supports from that perspective. We feel like we really need something that's formalized, something that we can put into play. And our private partners have really been very innovative as far as stepping up and sharing those ideas with myself and my leadership team in regards to how they can lift up these programs pretty quickly. So, to answer your question, it's not something that's been fully codified across the state. We have, but definitely have some good ideas and models that we would hope to mimic and mirror in the very near future. Lou, Amy, I don't know if you have anything else specific.
Okay, it sounds like that's all for that question, so we'll move on. Representative Braybeck, please go ahead.
Thank you, Chair. I appreciate it. Thank you all for being here and for giving us the update, both on what we're able to accomplish over the past couple of years, but also what we have to look forward to. I'm continuing to be curious about our young folks who are placed in residential facilities and wondering if we can talk about what our numbers looked like pre-COVID in terms of who is residentially placed and what our numbers look like now.
I'm going to turn to, go ahead.
So this is Janet from the Federation, and Director Starling, I don't want to step on your toes if you wanted to answer that question first, or if you'd like me to go ahead.
No, Janet, floor is yours.
Okay, well, thank you very much. And Representative Braybeck, thank you very much for asking that question. And I'm going to, I think, speak maybe in generalities and to say in general, pre-COVID, I believe that the number of children and youth in residential treatment stood at about 900 or maybe 940. At this current time, and Director Starling, you can correct me, I believe that the number in residential treatment care is a little over 400. And so that would represent a pretty fairly significant decrease in the number of children and youth going into residential treatment care. And so I guess I'll stop there and see if you have an additional question along with that, or if Director Starling would like to add anything.
Yeah, that's correct. Right now, we're standing around 460 kids who are currently placed in congregate care facilities or institutions. And, that is a very steep drop from what we saw a couple of years ago. But to add more context to that, I think it speaks volumes about the work that we've done in a partnership to find a more robust array of placements for those youth. So looking at kinship care, really leaning into that, also looking at independent living for some of those youth, and also other placements that fit the needs of those youth, whether it be in a treatment foster home or back or reunified with their families. it's something that, definitely want to add some more context to those particular numbers.
Yes, thank you, Director. And then I'll just add a little bit more too, and to say that, we appreciate the providers, the community-based organizations appreciate the chance to work with department leadership to really be developing other opportunities for children and youth who need that level of care that residential treatment offers and provides. And what we're very, of course, interested in is equitable access to those services. And Representative Braybeck, I know that this would ring really true to you, given especially your tours around Michigan in listening sessions with regard to access to behavioral health services. That is an area that not all children and youth in our child welfare system have always had equitable access to the same level of care or the same access to the services, which is something that is being taken under serious consideration right now as we're building other opportunities for that population.
Thank you. I appreciate it. Chair, if I may have a follow-up.
Go ahead.
Thanks so much. I appreciate hearing about how and if we are able to match our children with the appropriate level of care and setting for that care. What I'm curious about is those 500 children, are they now receiving, receiving community treatment today?
So we could certainly provide those numbers in regards to how many children are receiving treatment, but it should be noted that with the qualified residential treatment programming that we have, QRTP, that every child has to be evaluated by Maximus before they are placed in a congregate care facility to make sure that not only that particular facility has the staffing and the modality to work with that child and the high acuity of needs for that particular child, but also to make sure that there is a proficient aftercare program that's in place for that particular youth when that child is ready for to be off-ramped into the community or another like setting. So my assumption is that we're close to the 462 number of kids who are in care that are receiving those particular services, but I can probably get you those numbers pretty quickly here just to make sure that those numbers are accurate.
Yes, that would be great. I'm really would like to know more and curious about and have some worry about the 500 children who are in that in between, that are no longer receiving services, residential services, but were at one point deemed necessary for them, and how we are supporting and helping them now.
Okay, will do.
Thank you. Thank you, Chair.
Thank you for those questions. Representative Meerman, the floor is yours.
Thank you, Madam Chair. I've got two different questions, two different subjects, with your permission.
Go ahead.
First one is, how many kids are on a waiting list that are deemed needing residential care?
Yes, so as of yesterday, we had approximately 105 children who were awaiting placement into a congregate care facility or a facility that could meet the needs of that particular youth.
Thank you, Director. And then my second question has to do with SACWIS. Do the frontline social workers, are they integrated into that system, as they're dealing with the children and the parents? Like where, what parts of that system are built out? Who's seeing it now? and then kind of what's the timeline on when it's going to be finished?
I can take that question, Representative. So right now, indeed, the system will eventually touch all aspects of our child welfare system. So anybody who is working kind of from the front door, if you will, with our centralized intake all the way through to adoption. The benefits of the approach taken here in development of CWIS is that it's modular in nature. So it's pieces get delivered when they are able to be developed. So we're not going through kind of that waterfall process where you hear of like the big bang and now you have a whole new system A to Z that has to be digested by everybody, staff, managers, service providers, et cetera. So right now we started with the licensing module. So it's the licensing components of the system that are active, if you will, in addition to a new functionality delivered with CWIS that is a foster parent portal, allowing individuals who are interested in becoming a foster parent to initiate that process through a shared portal. Right now, in fact, as of yesterday, a bid went out for the next iteration or the next modules, if you will. And so this system development will take us into 2026 before it's fully implemented across all modules.
Thank you.
So we have 2 more questions. Representative Green.
Thank you, Madam Chair. I guess this question is probably for Demetrius, or Director Starling. On page 4, we have our flow chart, and one of the portions talks with court supervised. As we dug into this over the previous years, specifically some of the probate courts discussed a glaring opening that just happened, where all of a sudden they didn't have access to what placements were open, and our probate courts were spending an inordinate amount of time trying to make placements and eventually making those placements out of state. What is the status of communicating back with our probate courts and then getting our placements back in state?
Yeah, to make sure I'm hearing you clear, are you speaking specifically about one county or region or just across the state in general?
My understanding is that the majority of the probate courts are on a group chat and they are discussing with themselves where they have individually found placements. And so I would obviously I'm closer to one county or 2 counties or 3 counties, but from my understanding is this is happening across the state.
Yeah, so we do have a refined focus right now to make sure that there is a consistent line of communication with our judges, our jurists across the state. I know that there's one particular unit that myself and my leadership team meet with on a monthly basis that's led by Judge Allen and others, and Judge Hill. And we talk about some of those placement barriers, specific cases, and see if and when there are areas that we can lean into and provide some of that support needed to assist in some of those placement options. If there are other regions or counties that I'm not aware of that are having some of these challenges as far as ascertaining placement, I would certainly like to hear about those. We want to make sure, again, that line of communication is open and that we're all operating on the same page. We want to be semiotic in nature to provide all of our state partners, our stakeholders, that same assistance that we provide other counties when they try to find placement for our kids. You know, the preference, of course, would be for our kids to stay in state. So if there's a way that we can have more discussion, dialogue about that, I'll certainly be open to that.
And finally, Rep. Price.
Yes, thank you, Chair Morse. I think I'd like to direct my question to Janet Reynolds Schneider, because you mentioned your work nationally in some of these issues. I'd be very happy to hear anybody weigh in on it as well. I'm wondering, as we're looking at these investments, if there are some examples, some best practices from other states that we could look to model our investments in these services.
Yes, absolutely. And thank you for asking that question, Representative. And I think the best way for me to answer that and to provide, the best feedback is specifically, which areas you're most interested in, because I can, bring information from several different states. I know, each state has a little bit of a different system. And right, and I know that our state leadership is involved with other states' leaderships as well. And so that's very helpful. But the organization that I'm part of, National Organization of State Associations for Children, there are 36 members of that. So 36 other states have child welfare associations similar to the Michigan Federation for Children and Families. And so from that, I can draw information. For example, just anecdotally, many of the states are also experiencing changes in how residential treatment services are being accessed and utilized, access to behavioral health services for children and youth in those states. The reimbursement rates, that's certainly something that I have access to. And what we want to make sure of is that we're comparing, apples with apples. So if it's all right with you, I'll connect with you directly in your office and see sort of the line of distinction you'd be interested in, and happy to provide that information.
Thank you.
Yeah, thank you. Yes.
And additionally, if I can just add, from the department standpoint, we work closely with APSFA, which is the American Public Services Association. It's a nonprofit organization made up of multiple programs and jurisdictions throughout the nation that's there to assist families and improve their lives. And one of the things that we've talked about in a lot of our conferences is, what do we do collectively as child welfare systems? Or how can we draw some ideas and mirror some practices and progress we see in other states in this particular area? Myself, Director Rubel, and others have been a part of some really rich and robust discussions, and we feel like some of these discussions will help us with some of our child welfare system transformation here in Michigan.
And Madam Chair, if I could just elaborate a little bit more on that. One of the things that I want to make sure that you all heard, that we are all nationally accredited, and that gives us access to best practices throughout the country. It's a very intense process every 4 years, and we have engagement, and the director and the department have really supported some of the ideas that we brought forth. Most recently at our organization, we did a very, very detailed research about prevention, and we have instituted a program called Parent Child Plus, where we work with particularly mothers. I don't call them single mothers because I took biology, so they're mothers, and they who have not had good experiences in high school or not graduated. We go into the home. This is a program that's not through the department, but through the community, where we go into the home twice a week with a book, a toy, to really help the mother engage. Then we guarantee those children a spot in Head Start, and 100% of these children would have never been in Head Start. Then we work with Friends of the Children, and then we have what we call the Orchard's Promise Scholarship. So there is no aging out as it relates to the relationship we have with our children and families. It's a term that I choose not to use because the relationship is vital towards success. But the department has been in lockstep with us to look at new innovative ideas and the challenges. And last but not least, one of the things that you saw is the major investment in technology. I would hope that you also consider what we will need to adapt our systems to that, because that's something that we usually have to raise monies through our private partners and through our board members, and I don't think that's something that we want to do to have best practices. It also is unfair to particularly smaller organizations that don't have the resources. We should be able to engage and make sure that they're able to perform from a technology perspective the same level of engagement that the state has. So I would ask you to consider that as you're looking at appropriations.
I also want to mention, if you're looking at data, national data going back to the crisis in our child welfare workforce, there is a lot of data that has come in the last couple of years, including data from our National Child Welfare Workforce Institute and Casey Family Programs. So we are doing a lot of innovation with the funding that we the small funding that we do have, but there are good models, very good recommendations that are coming out of reputable national sources that do need attention.
And I would just like to also add that through AFCA and the Federation, the department has really approached all of our organizations about the innovation that we can bring forth to help support the children in the system. There were discussions today about developing respite services. And so we as private providers have some things that we've done privately through donated funds that don't always sustain us to be able to come up with some innovation around funding supports that are needed for respite care and how do we deliver those respite services. So again, all of the things that you're asking about, we are partnering with the department and stand ready to provide that innovation assistance to the department. Thank you.
Well, thank you all so much. We actually do have one final quick question from Rep. Green.
And thank you, and sorry we sorted the rope-a-dope on dismissing. Over the past couple of legislative sessions, we've had different discussions, and could you give us an update on the number of, we talked about those that are on a waiting list. We've had previous discussions about those that are being held overnight in DHHS offices, hotel rooms, or not being able to get a placement because they're in the emergency room. Can you get us those updated numbers for us to find out how far we've come in the last little bit?
So I could start off, and again, Lou, if you want to add any additional information. There was a refined focus by Children's Services, and there was discussions that occurred with all leadership from all of our counties to talk about the importance of making sure you do that extra step, comprehensive review when it comes to those kids who are either in hospital settings or who are sleeping in offices. I'm pleased to say that since we had that conversation with our leaders late last year, that we have not had one overnight stay of a child in our county offices. But again, it speaks to the extra work that's being put in place by our staff to make sure that they're uncovering all stones or reaching out to other stakeholders such as the front of the court, working with our private agencies, working with folks who are on this call to see if there's anything we can do to look at a genogram, to do a very thorough search of previous case files to find either a potential kinship care provider or another likely familial-like setting for that youth so they don't have to spend one night in a hospital or in our offices. So I just want to commend all staff, both private and public, in their efforts, their ongoing efforts to ensure that kids don't have to sleep on a couch or sleep in a hospital bed over the last several months. Lou, I don't know if you had any additional information you want to add.
Well, I want to thank all of our presenters today. We are grateful that you made it today, and we wish you all a very safe trip home. Thanks to my colleagues for your wonderful questions. And seeing no further business, this meeting is adjourned.